We're going to start the assessment with vitals. The vitals on Tina. Looks like blood pressure is 128/82, normal. Heart rate of 78 with a respiratory rate of 15. Next, we'll start with looking at her head, looking at her hair, her face. It looks like she's got some pustules on each side of the face. It's indicative of some acne, which is normal for someone of her age. Scalp looks good. Looks like hair is normally distributed. Scalp and head show a normal cephalic shape of the head. Go back, take a little further look, palpate, look more specifically into the hair. Looks good. Nothing out of the ordinary. Take a look at her throat. Looks moist. No redness or abnormalities noted. Depress the tongue. Move the tongue up. See underneath the tongue. Don't see any issues there. Look to the opposite side. You're looking for any pustules or redness. Nothing doesn't really spark any interest at this point. No pain. Take a look at her ears next. You see some hair on each side of her face is appearing to grow along her ear line. Take a look at the lymph nodes. Setting up the head and neck area first. Look at her temporomandibular joint. Have her open and close her mouth. Both sides will look good. No issues with that. Good full range of motion. Calculate her thyroid while she swallows. It appears to be normal as well, without any nodules, no goiter present. Next, we'll go to the sinuses. Take a look at upper sinus. No pain noted when pushing and palpating. Same with her lower sinus, maxillary sinus. Both sides look good. No pain reported. Inspect her eyelids. Looks normal. I don't see any redness or inflammation in her eyes either as well. No conjunctivitis. Need some pen light to see how reactive her pupils are. Turn the pen light on. Looks like it's reactive. See right to the opposite side. Both are pearl. Take a look further in each eye. See a little different changes in her right eye compared to her left. Also go back to her ears. Look at her eardrum. Looks nice and pearly gray. Compared to the opposite side. Looks good as well. Look up her nose. Don't see any issues with the turbinates. Don't see any swelling. Don't see any mucus. Looks normal. Assess the eye movements. Tell her to follow my finger. She can follow my finger around. Let's get that here in a second. Tell her on my keyboard to follow my finger. She will show that normal movement of the eye. We'll assess the peripheral vision. The peripheral vision will come back normal as well. Next, we're going to go to palpating and looking at her abdomen. Start in the upper right quadrant, and as we're looking here, you can see a little darkening around her belly button along with some hair growth as well. Palpate right lower, left upper, and then the lower on the left. All looks normal, no masses, no pain. Abdomen is protuberant, but rounded, nothing out of the ordinary. Also take a look by auscultating her abdomen, every one of those quadrants, see if we notice anything else abnormal. Everything is normal or active. All sounds appropriate. Go back to looking at her organs. See how her liver feels. It's palpable 1 centimeter below the right costal margin, which is normal. Look at her kidneys. No mass is apparent on the right kidney. Take a look at the left kidney. No issues there as well. And also look at her spleen, which isn't palpable. All looks good. Percuss the abdomen, see in the same area, see if there's any pain or any dullness apparent, which is all tympanic and no dullness noted. Her liver span. Goes back as normal, 7 centimeters on percussion. So let's do a deeper assessment of the organs and the quadrants. Start in the upper right, right lower, no masses, no pain, watching for any grimace. Doesn't appear to have any issue with any deep pressure in any of the quadrants. We'll next go to looking at her carotids and different arteries throughout the body. No bruit heard in the right, no bruit heard in the left. Both carotids are good. Look at the abdominal arteries. No bruit renal arteries, along with the abdominal aorta. Bruit on the iliacs, and also look at the femorals. All normal. And what we'll do next is also auscultate the cardiac points. Notice any abnormal clicks or murmurs, everything sounds good. S1, S2 heard. We'll look at the peripheral pulses. Go back to those femorals, both the +2 bilateral, popliteals, and the knees are +2. And we'd also check her posterior tibial and dorsalis pedis. Those also check back to be normal, +2. So our peripheral vascular system is pretty good here. Nothing abnormal. We'll also palpate her PMI, point of maximum impulse. Looks normal. Look at the carotids again. Noted there's no bruit before, but see there's no issues on each side. No thrill. Also look at the legs for any edema. Looks like each are equal. No edema. Let's also look at cap refill in the legs. Also look at the skin, the nails, everything else looks good here in the feet. Good cap refill. Also check the cap refill on the fingers, which are normal as well. I think look further at the chest to see for some expansion. Looks normal in the chest, equal on each side. Look at the back side. Looks normal. You see some stretching in the lower back of the skin. Expansion, we'll check to see if everything looks normal, symmetric expansion. Also, they have her check the inspirometer, blow into the spirometer at a tether. It comes back as should be normal. Doesn't appear she's any difficulty. Looks good. I'll also palpate and take a look further at her chest.
Marginal.
Looks good. Tactile fremitus, both normal. It's the same as the back side here.
Marginal.
Normal. Let's listen at her lung sounds. Lung sounds also normal. No deformities. That sounds equal bilateral. Also assess her legs. See if she has any sense of pain. Okay, looks good. She knows her name, date of birth, everything else is normal. Assess her. Do that already too. Look further and get auscultations. Do some deep tendon reflexes here quick. Deep tendon reflexes, both sides are normal. Do some range of motions quick on the neck. Looks normal. Have it rotate side to side. Doesn't appear she's having any issue doing that. Also take a look at her legs here too. Invert it each side, no issues there. Do an extension and flexion of their feet. Push doors against people's sides. Any issues with that? Doesn't appear to have any issues. Looks good. So everything's looking pretty good in both the majority of her assessment here. Also check each one of her strength in her elbows, hips, shoulders, knees. Inspect her hair further. We did that before. It looked everything else was good. Fingernails and toenails we've seen already. The skin throughout her body. There's some darkness in her neck, and also her belly button area that we've seen before. But for the most part, everything else is looking really well here with her musculoskeletal system. Cardiac-wise, everything else is normal. GI, everything else is normal for there. We noted her protuberance in her belly. Neural-wise, everything else is within normal limits, and assessment-wise, everything is where it should be. So she did really good.